The CDC is now recommending all Americans 6 months and older receive the latest COVID booster shot as cases start to rise again. That recommendation comes just a day after the agency approved the new shot, which could be available as soon as this week. But some public health officials aren't convinced that the new vaccine will actually help. So joining us now is the Surgeon General of Florida, Dr. Joseph Ladapo. He's also the author of Transcend Fear. Doctor, thanks for your time this morning.
It's a pleasure to chat with you.
So the title of your book, Transcend Fear, that really plays right into the news of the day, right? I mean, many people are fearful of the CDC's recommendation for the new booster. You're warning Americans against it. What red flags are you seeing?
Well, I would say that people aren't so much fearful of the recommendations as they are uncomfortable with the types of decisions and the rationale for those decisions the CDC and the FDA have been making for the past 2 years. Everything from the encouragement of mandating the vaccines to recommending them in young, healthy people and just blowing past all safety signals. So there are a number of safety signals. I think many Americans recognize this, even though the CDC and the FDA aren't saying it. And even since we've made prior recommendations, there are actually new ones about more cardiac injuries, such as subclinical myocarditis, and other concerns about negative effectiveness, which is this concern that individuals who receive the vaccines are eventually more likely to contract COVID-19 than individuals who don't. And that is totally abnormal.
Yeah, and tell me this, why would federal agencies be pushing these vaccines if they don't work?
Well, I'm not saying so much that they work or they don't work. I'm more just talking about what we see in the data. And as I mentioned, one of the major things that we can pretty definitively say now from multiple studies is that they actually, over time, increase your risk of contracting COVID-19, which is completely abnormal. Why the federal government has been pushing this, along with a series of other decisions that we know from prior scientific research are bad, everything from the isolation, the lockdowns, the
masking that we watched Dr. Fauci just do an about-face on.
Yeah, right. I mean, it doesn't make any sense to me. And I think my role as really just being a voice that can help Americans feel better about what they're feeling anyway in response to what we're hearing from these health authorities.
Yeah, and I do have to bring up, you are Governor DeSantis's handpicked Surgeon General, and the governor has been very vocal about his disdain of pandemic-era COVID-19 policies. You've also obviously faced a lot of backlash for your stances here. What do you say to critics who suggest that your recommendation against boosters is not only politically motivated, but it's also dangerous?
Yeah, I think people are obviously entitled to their opinions. I think anyone who looks in history or even takes a look at my book, Transcend Fear, will see that my history from the time I was a professor at UCLA and tenured there with a pretty expansive research program that NIH funded, I've been vocal. I've been writing in the Wall Street Journal, writing about the masks, I've been writing about the lockdowns, I've been writing about these mandates and things that just don't make sense. So I've certainly been consistent. People are obviously free to infer whatever they think about my motivations, but what won't change is my commitment to people and human beings and their right to receiving good information and not being persuaded to take things based on false information, manipulation of fear, or hiding of safety data.
And I know that you're saying, the data's not there as to the efficacy of these booster shots. Is there any patient who should be getting a COVID booster shot this fall? I think about my cousin who has cystic fibrosis. Are there people who should be getting it, though, doctor?
Yeah, it's a very good question. And as I've said before, my concern is we're now in a period of time. You hear the director of the CDC talk about these shots, and you hear her talk about how they're going to help reduce hospitalizations, they're going to help reduce deaths. The problem is it's very important for Americans to recognize that she's saying these things in the absence of data about these boosters. There is not a single clinical trial of their effectiveness or safety that was performed.
Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.